Oh, my goodness gracious. Hello, hello, my friends. It's Jill Osborne. Hi, everyone. It's Jill Osborne from the Interstitial Cystitis Network. Had a little blip. Took me a couple minutes to set something up, so I'm a little bit late. Sorry about that, but that is indeed life on the internet. You never know. Just when you think you've got everything set up perfectly, you see that you have missed something. Anyway, it's a Memorial Day weekend. And most people don't work on the weekends. I do because I know that there are patients who can't go out and do the things you would normally do with your family. Here, hold on a second. There we go. So I always drop in, even on holidays, just to see if there's anybody who might need a little bit of extra support, a little bit of comfort, a little bit of encouragement. If not, that's okay because I got plenty of other things that I am going to do. Hi, Star. Hey, sorry it was so late. I was actually having problems with YouTube, believe it or not. And I got to fix your camera a little bit. There we go. There we go. Okay, Facebook, how are you guys doing? Hello, Facebook. So anyway, oh, it's a holiday weekend, and I really, really hope that you're having a wonderful time today. I hope that you're not in a flare. I hope that life is treating you well. I hope that you get to do something fun. Well, okay, hold on. I got to take a freaking step back here. Memorial Day is not a fun holiday. Memorial Day is a very, very important holiday that we use to recognize the sacrifices of the men and women who have served our country. I come from a very, very strong military family. Generations back, U.S. Navy. I've got pilots in my background. I've got nuclear operators on submarines as family members. You name it, I've got it. I have family members. My grandparents are buried in Arlington. And so on this day today, I want to say to any IC patient or pelvic pain patient who is struggling with symptoms that I'm here for you. You can call me anytime. I once had the squadron commander of an F-16 group in the Middle East call me. They were looking for chair cushions. As soon as he told me who he was, it's like, I didn't charge him a damn thing. Are you kidding? I sent him a dozen cushions that were in F-16 fighters for years to help men who had pudendal neuralgia. And just got estradiol cream. Excellent. So I want to make this offer again and again and again. If you are active duty, if you are retired, if you have a family member, you have a spouse, I am here for you. I want to help you. Hi, Gay. I'm good. I'm very, very good today. Yeah, you know why? Because I'm back at the gym. I've been back at the gym now for about 2 weeks. I'm working out almost every day. Feel like I'm getting my strength back. I feel like I'm finding me again. I felt very lost, recovering from breast cancer. You just get lost. And I have been feeling very, very lost for the last year. But now I'm finding me again. And that's a good, good thing. So anyway, when I normally do these meetings, I am here as long as you have questions. If you have questions, I want to do everything I can to answer those questions. I'm also here to share the latest news. I'm also here to share self-help tips, etc., etc., etc. Normally when I do these meetings, I do a little 30-minute, 15, 20-minute intro on something that's important, and then I'm more than happy to take your questions. Star says, I was going to ask if you can call you from the UK. Girl, I work with patients in the UK all the time. I love the UK. The big challenge is just making the timing work. And so if I remember correctly, if it's like you're 8 hours ahead of me, 9 hours ahead of me. And so if we do network at mac.com and or you're just welcome to give me a phone call anytime you want. Message, leave your email address, and I promise you we will make it work. I have worked and with patients in 90 countries. So we will make it work. Becky said she's dealing with a flare from histamine intolerance. It began 3 months ago. The IC flare just started this week. Taking aloe tabs from Desert Harvest, watching food, drink, being patient as I can. Cheers to you. Thank you, honey. So, that Becky, that's a great entree because I'm going to talk about my toolkit. So, what's your toolkit? Your toolkit are the essential things that you have at home that will help you get through flares like this. Okay. Because what we don't want is we don't want you to suffer in silence. We don't want you to be up all night. If there are things that we can do, that you can do that will help to moderate this flare, I say, why the hell not? Let's give it a shot. So I've got two separate piles back here. I've got my pelvic floor flare must-haves, and I've got my bladder wall must-haves. So let's do, and you guys, I am finishing up. We have almost done with our brand new flare guide. It is 60 pages long. The many, many different types of flares now massively expanded. I sent it to Dr. Robert Eckenberg, our top pelvic pain doctor in the country. He's having a look at it and he might add a few things. And so we are almost good to go with our new flare guide. I'm so very excited. And if you're an IC Network member and you get our Optimist, you're going to get the flare guide as your spring Optimist. Okay? So it's at the typesetter right now. So let's go. Let's do our bladder wall flare first. Okay, so hold on a second. Okay, so bladder wall. A bladder wall flare happens when the bladder is irritated in some way. So it can, and it can also happen from, oh wait, what am I sitting on here? It can also happen from stress. It can happen from hormones. You know, when it's very normal for patients to flare the day that they ovulate, a couple of days before their period. Hold on, I'm just trying to get these camera right. Okay. So the great frustration is that a bladder wall flare will have you up all night. It will have you peeing every 15 to 30 minutes, all from doing something during the day that might have tweaked your bladder. So the worst flare, one of the worst flares I ever had, I wrote an article on it. It's called Anatomy of an Utterly Ridiculous IC Flare. This was right after I was diagnosed, and I was still like going, oh, I don't really want to follow the IC diet and all that sort of stuff. And so that day, I think I started the morning with something like a Mexican omelet with salsa. And then for lunch, I had a pineapple juice smoothie. And then for dinner, I think that I had something like pasta, you know, tomato-based pasta. Let me tell you, did that flare hit me like a truck that night? That was absolutely brutal. And that was really a very, very kind of a watershed moment for me, because that's when I could not deny that at that time, I was extremely sensitive to food. Now, to give you guys hope, I'm not sensitive to food at all now, because my phenotype for IC is pelvic floor widespread pain. It is not bladder wall. So once I was able to get my pelvic floor straightened out, my bladder got the blood supply it needed to become healthy again, I can drink lemonade every day. And I do drink lemonade every day. Didn't do it for 30 years. I'm doing it now. I have no flares at all from it. Phenotyping is a whole nother story. But back in the old days, when my muscles were as tight as a drum and they were restricting blood supply to my bladder, and I was in a state of ischemia, my bladder wall was breaking down, and absolutely, I was extremely diet sensitive. So what are my flare strategies for bladder wall? Number one, if you've done something like I did and you've eaten and drunk way too much acid and something irritated, the very first thing you do is you dilute your urine. You gotta flush that stuff out, my friends. Spring water. Spring water. You know, I mean, I could say a lot about water right now. There are some people out there who say you should be drinking alkaline water all day. And the answer, of course, is no, you shouldn't be drinking alkaline water all day. That's going to strip your bladder just like acid would. The best water you can drink during a flare really is going to be a basic spring water. Got to flush it out. Now, this doesn't mean you drink a gallon of water or even a half a gallon of water. We had a patient in one of the groups who said that he drank a half a gallon of water and then he flared terribly because he did it right before he went to bed. And he basically gave himself a hydrodistension. He filled his bladder so full that night that he was a wreck the next morning. And it's going to take several days for his bladder to calm down. I used to always say to my support group, you always know I see patients by how they drink. Because we don't guzzle a bottle of water. We sip it over a period of hour because the goal here is to just keep a steady supply of water, diluting any irritants out there. Okay, so that's the number one must-have. The number two must-have is once you've diluted your water, but you're still got a lot of residual acid in it, the next thing you can do is go with pre-leaf, which alkalinizes your urine. It will take the acid and neutralize it. Now, you can also do this with Tums. You can do this with a quarter teaspoon of baking soda and a glass of water. You got to be really careful if you're going the baking soda route because baking soda is, in fact, sodium. Sodium can raise your blood pressure. This is why we tend to go with a calcium-based supplement instead. So pre-leaf is a no-brainer. Okay. When the flare kicks in, you have to understand that your body reacts to the pain by tightening muscles. And so every single time I had a flare, and still to this day have a flare, heat is my friend. Body heat heating pads, I'm telling you, are one of the favorite things that we have sold in the IC Network shop for years. And guys, they're cheap. You can get 3 for $3.99. Or I think it's $4.25 now. We've only raised the price once in 20 years. And I think we did like 4 months ago because we had to. Okay. Look at how slim these are. Basically, you attach it to your underwear. It will deliver heat for 8, 9, 10 hours straight. If you're traveling, you cannot go wrong with a body heat heating pad. If you're getting on a plane, you're going to get in a car for a long period of time. The giving heat will allow these muscles to be soothed and they will relax so they won't contract up and cause more pain. So absolute must have. I have a box filled with them for me because if there's anything that I use consistently, it's these. And some days I wear 3 because I get spasms in my left psoas muscle that goes up the left side of my back. And I will just have 3 in a row going up my spinal cord. Okay. Obviously, another must-have when you're having a bladder wall flare is you're going to go for the bladder-friendly foods, right? This is not the time to do the bad foods. This is not the time to do the coffee, the green tea, the black tea, the soda, the 7-Up, stuff like that. You've got to stick with the bladder-friendly foods, and we have this simple little card that has them. You can order them in the IC Network shop. You can get 3 for $2.99 or $3.99. Okay. For me, now that we understand kind of the biological mechanisms behind bladder and pelvic pain, we know that nerves are very, very involved, especially if you have widespread pain like I do. You have the chronic overlapping pain conditions. You have very, very sensitive skin, wicked sense of smell. I have IC, IBS, vulvodynia, TMJ, migraines. We know now that is being driven by the central nervous system, and we know that we have to work hard to keep our central nervous system fairly chill. How do I do it? I do it with Peora, Peaora. I take this every night. Took it last night. The IC research study that was done in 2019 showed that 87% of patients had a significant reduction in their pain and discomfort over like 4 to 5 months, the 4 to 5 months that they took it. For me, I will tell you that before I started taking this, I had extremely sensitive skin. I had small fiber polyneuropathy. I kept feeling like I was being poked by pins. I'd have a big tub of CeraVe in bed with me. And you know how it is when you're chasing dry skin and you put some lotion on this one spot that's dry and then it's somewhere else. So it'd be my left shin, then it'd be my right shoulder, and then it'd be in the middle of my back. And I would just be slathering my body with CeraVe, trying to calm this pinpricking sensation. And it was so bad that there were some nights I really couldn't sleep, and I took Norco. So when this study came out and I looked at the data and I looked at the research, and an outstanding safety profile for the great majority of patients who tried, if you look at the research studies, no known drug interactions, and just, again, a stellar safety profile. I was like, okay, I'm going to try it. I don't like taking stuff because I'm a redhead and I'm really sensitive. And most of all, my opinion is not for sale. Believe me, I've had a lot of companies offer me money to say, hey, you can try our stuff. We'll give you our stuff if you'll give us a good review. I don't do that. It's very, very rare I would ever do that. I am giving you a personal testimonial here that this has, of anything I've ever taken, this has been the most helpful for me. But again, I am a widespread pain central nervous system patient. Getting back to our bladder wall flare kit and getting back to Becky. Becky is in a flare right now. She's taking Desert Harvest Aloe. Aloe has a soothing effect on the bladder, just like it has a soothing effect on a sunburn. But the aloe that I suggest is Aloe Path. And this was actually my idea. This product was actually my idea, where I wanted to enhance the soothing effect of aloe by including some PEA in it. And so you got the soothing effect of the aloe combined with the nerve calming effect of the PEA in this. So we have a lot of patients now who are using this one for bladder wall flares because, again, we're tackling that irritation in two ways. And then, of course, the newest thing that we have is really for those patients who have a very red, inflamed, severely inflamed bladder, maybe Hunner's lesions, and that, of course, is lactoferrin. Our IC study with lactoferrin that came out last summer showed that 28 out of 31 patients had a significant reduction in their pain and symptoms. Their red inflamed bladders became pink and healthy, and Hunner's lesions almost completely disappeared. So when people ask me, a lot of people say, they call, okay, Jill, what's new? Tell me. In fact, I had somebody on Friday do that. What's new? Tell me what's new. And they hadn't watched any of these meetings for about 5 years. They didn't know about the phenotypes. They didn't know anything. And then I was telling them about lactoferrin and its ability to improve Hunner's lesions for some, but not all, but some patients, combined with PEA. These are the two newest things that we have. Okay. So anyway, these are what I would consider our bladder flare toolkit essentials. Maria said, Lisa, thank you so much for the 200 stars. Gay says, love my pre-leaf. She also says, water is the best to drink. You know, I've been drinking coconut water. I have to say, after I had my surgery, I kind of went down that sugar pathway. I don't drink any soda. I just don't. But I was doing a little bit more fruit juice and stuff like, and Gatorade. I do Gatorade if I'm feeling ill, and I'm just trying to lose some of that extra weight that I shed while I was recovering. So I'm getting there. Okay, Maria said, I just saw a pelvic pain neurologist. She examined me and saw vaginal atrophy, left resorb labia minora, and a slight clitoral adhesion. She recommended estradiol testosterone cream compounded. She feels the lack of hormones could be driving my bladder pain. I want to be hopeful. Could this be one of my main root causes? Girl, absolutely. Absolutely, Maria. I talk about this all the time. I even have a video on it. This is called the genitourinary syndrome of menopause. Think about your bladder for a moment. It's the only organ in the human body designed to hold toxic waste, right? Because urine is body waste. Urine contains ammonia and urea, and God forbid any other harsh chemicals you've been exposed to, like the toxins produced from cigarette smoke and toxins in the environment that end up being absorbed in our body. Our body's trying to eliminate these toxins, and it ends up basically dumping them in our urine. So, how does the bladder defend itself from this chemical overload? And the answer is your bladder has a really thick coating of mucus. So your bladder is like your mouth. It's a hollow organ that's wet and slippery on the inside. And the purpose of that mucus is to act as a barrier. It protects the skin. It's hydrophobic. It pushes urine away from the bladder wall, the more fragile cells and nerves of the bladder wall. So mucus is essential. The gag layer is essential for bladder wall health. Here's the rub. Mucus production is estrogen dependent. Your bladder needs estrogen to make mucus. So when you're young and have a lot of estrogen, you got a lot of mucus, girl. But if you're on birth control, whoops. We have a case study of an 18-year-old who went into basically estrogen atrophy and diagnosed with IC, and it was all related to birth control that was too strong with her. If you're on Lupron to suppress endometriosis, same thing. Or if you're just getting older. This is not a disease process. This means that your bladder's ability to defend itself is compromised because you're just in atrophy. And you know how painful dry mouth is. Dry mouth hurts. Well, dry vagina hurts. Dry urethra hurts. Dry vulva hurts. Dry bladder hurts. And so therapeutically, our priority is to help the bladder produce more mucus. And the way we do that is with estrogen. So the fact that your doctor gave you an estrogen is great. It's great. But the reality is for those of us who are getting a little bit older, we can't stop the march of time. And sometimes your bladder can use a little bit of extra protection. And that's where the chondroitin-based supplements might be helpful. And then if they don't work, you could ask for bladder installation. So for example, that's going to be Bladder Builder, Bladder Rest, Cystomend, or Cystoprotect. Those are the top chondroitin-based supplements. And I can show those too if you want to see them. Also, Maria, I just want to say the other thing for women out there who are watching, and the husbands of women wondering how their body changes as they get older. One of the things that happens is that your labia, which are the little folds of skin that basically protect your urethra and your vagina, they resorb. They basically disappear. Mine are gone, pretty much. So it's quite weird. Clitoral adhesions, it's a whole nother story. You got to really work on keeping your skin as healthy as possible. One of the things that I would suggest to you is a vulva balm. This is what I use. You can only use the estrogen a couple of times a week, but you can use this every day. And it very closely mimics the normal mucus of your skin. So you can see it's like it's just like a very light. I mean, it's not even though it's an oil base, it doesn't feel particularly oily. This is as close as you're ever going to get to matching the normal mucus on your skin down there. So this is absolutely in my IC toolkit for those moments when I start to feel dry down there. Okay, so anyway, there's some of the bladder wall essentials. Oh, now let's talk pelvic floor. Wait, hold on a sec. Whew, thought I accidentally turned off YouTube there. All right, hold on. Okay. Now, a pelvic floor flare is different. Oops, kind of weird. Okay. So again, my bladder is healthy. Yes, I have, there's probably a little bit of estrogen atrophy going on, but I don't have Hunner's lesions. I don't have a red inflamed bladder. I have a pink and healthy bladder that looks great. And that's been confirmed in multiple cystoscopies as well as a hydrodistension. You know, guys, hold on a sec. I gotta try to figure this out. My screen keeps moving here. Okay. So when I flare, odds are it's going to be a pelvic floor flare. It's going to be a pelvic floor flare. If I sit for a long period of time, if I have taken a long drive, if I have sex, if I have to, God forbid, ride a bus down to the San Francisco airport to fly anywhere, that bus ride, that bouncing on that bus ride just kills my pelvic floor. My pelvic floor was originally injured when I broke my tailbone when I was a teenager. I have done many, many rounds of physical therapy. Physical therapy is stunningly helpful for me, but my individual issue is that the left side of my pelvic floor is always tight. Why? Why is my left side always tight? And it goes down to the fact that I have an SI joint that's funky. My sacroiliac joint moves too much, so my piriformis muscle on my left side locks down very tight to stabilize it. And until I get the joint fixed, I'm going to have tight muscles on my left side. It is what it is. So if I'm having a pelvic floor flare, I always know when a flare is starting by how I pee. If I can pee like a horse, I'm good, my friends. If I'm starting to stop and start, my urination is just restricted and delayed, then I know that my muscles are starting to get tight. And I most always, like, that's step one. Step two is I will start feeling rectal pain, but it's not my rectum or my anus at all. It's the muscles about an inch or two away. They're starting to get tight and painful. That's when I know I'm starting to have a flare. So what am I going to do? Okay, well, as soon as I feel that flare happening, I'm going to start with heat. I'm going to start with a heating pad. I'm just going to stop what I'm doing, go sit in my recliner, grab some heat for 30 minutes. Listen, my microwavable heating pad is used multiple times a day. And when I wake up in the middle of the night, which is usually only once a night, I heat it up in the microwave and I take it back to bed with me. Okay. Heat, my body craves heat. My tight muscles crave heat. So heat really works for me. Okay. If that's not doing the job, the next thing I do is I do my wand. Because I know that this is not a bladder, even though I'm peeing more, it's not a bladder wall flare. It's a pelvic floor flare. And so I am now experienced enough that I can do my own internal pelvic floor work. And I do it with a wand like this. So basically, I lay on my back, I got my feet up on the wall. This is obviously well washed, a little bit of KY, stick it up where I need to, which is in my vagina. And I'm looking for tender spots. And what's so interesting, you can find that tight muscle very easily. You start on one side, work on that one side for a while, then you move over to the other side. You don't go back and forth, back and forth. You start on your left side or your right side, work on those muscles for a couple minutes, get them to relax and release, then go over to the other side. And we can talk more about that if people have more questions about that. But basically, when I put this in, I'm looking for tight spots. I'm looking for anything that's painful. And when I find something painful, I rub around where it's painful. Let me get my model. Okay. And I know that sounds vague, and hold on a sec. My chair is stuck on my desk. What happened? Ah, there we go. Listen, pelvic floor work, there is a learning curve. There is a big learning curve when it comes to being able to find and massage muscles. It takes a lot of time and practice to kind of get where you need to be. So let's talk about this for a moment. So hello pelvis. So here is your pubic bone, hip bone, hip bone. If we turn it around, we've got our vertebrae, we've got our sacrum, we've got our tailbone. And I want you to look at this tailbone. Your tailbone does not just hang there in isolation. There's lots of things attached to your tailbone. Your tailbone right now is helping you move and balance. It's adaptive. It's also centered. It is the foundation of your pelvis. So you can see it's centered and it curves under. So it hangs down and curves under between your legs, okay? Now, what's going to happen if you break this tailbone like I did when I was a kid? Well, number one, we've now lost the structural integrity that attach these muscles, etc. Well, I broke the tip of my tailbone off completely. This floated around for about a year before it finally did something. For me now, it's like a little round knob of scar tissue, which is just crazy. Lots and lots of tailbone injuries in the IC patient pelvic floor patient group. All right. So lots of things happening to these tailbone. And so I always challenge every patient that I work with. I always say, okay, take me back in time to when your symptoms began. Is there any event that you associate with the onset of your symptoms, like a fall? Again, tailbone injury is stunningly common. Okay, let's look at it from the top down. So there's your pelvic floor muscles right there. So you can see that they're flat. They live at the bottom of your pelvis. You see that? So they don't just go across. They can't just go across because you got a bladder and a uterus and intestines in there. The pelvic floor muscles hug the bones. These are skeletal muscles. These are muscles that help you move your body. These are muscles that help you walk. And so these are working muscles. These are very interesting working muscles because they're small but mighty, but they have a very specific position and a very specific role. Okay. And if we look at it from the bottom, you can see that if you sit on a bicycle seat, you're pushing right up into the muscles. And technically we're missing, I need to put the outer layer of muscles on it. The outer layer of muscles, which are the levator anites, are right here. And you can see the hole for the urethra, the hole for the vagina, and the hole for the rectum down there. And then, so this is why riding bicycles and motorcycles and horses and things like that, or if you're a gymnast, I was working with a gymnast last week, you had really significant issues. That a fall like this, if you land on these tissues, another patient, for example, was doing a leapfrog jump over a fire hydrant, and she landed on top of the fire hydrant. And so that hard metal knob hit her right in here, and it was so bad she was bleeding terribly and had to go to the doctor. I had to go to the emergency room. So any traumas between the legs to these tissues can create the foundation for a lot of the symptoms that we can struggle with today. Okay, now, so how do we reach these muscles? Well, this is the challenge here, because these are muscles inside your pelvic cavity. You can't just on the outside push on your hip and reach this muscle. It's protected by bone. The best way to work with these muscles is internally. For women, that's through the vagina. For men, that's through the rectum, although women sometimes have rectal work too. I've had rectal work. It's okay, not a big deal. So you can see with my finger, look at how easy it is for me to follow, to find the muscle and follow the muscle, right? So easy to do, and you can get far. So when you're working with a doctor or a physical therapist and they're doing that internal work, this is what they're doing. They're just looking for tight, tender spots, and then they're going to just kind of soothe and rub the muscle. If they find any trigger points, they might push on that trigger point like this. Generally, they'll follow the length of the muscle like this, or they might do something called strumming, where you're strumming at a 90-degree angle. We're just trying to get this muscle to relax and relieve. And that's what I do when I have a pelvic floor flare with a wand, because you can't really do it to yourself with your finger. You just can't get that far. But if you use a wand, look at that. You see how easy it is for me to get in there? It's so easy for me to get in there and work with these muscles. You know, a lot of people, they're desperate for a diagnosis. You know, it's like, please tell me what this is. Is this I all I know is I can't pee, and I can't sleep. I'm peeing all the time. I feel like I have a bladder infection, but nobody has found a bladder infection. And when somebody finally says, I think you have interstitial cystitis, you're like so grateful to have a diagnosis. And of course, you come home and you start reading about it. Today, we have to take it one step further. And that is, we have to ask ourselves, gee, what's victimizing the bladder? Because the great majority of us have normal bladders. 85% of us have tight pelvic floor muscles. 85%. And so back in the old days when we were all given bladder treatments, it never worked for me. Patients spent thousands of dollars doing things that didn't have a bat chance in hell of helping them. Today, now that we know to look at the muscles, now that we can use phenotyping, we can identify the right treatment for you and the right therapy for you. And so DMSO didn't work for me. Rescue installations didn't work for me. Neuromodulation didn't work for me. None of antidepressants didn't work for me. Antihistamine, maybe a little bit. What worked for me was pelvic floor physical therapy. And when I finally went and had my pelvic floor checked, my pelvic floor was as hard as a rock. It's like no wonder I had been struggling so long with symptoms. I simply didn't have healthy muscles down there. Again, all going back to this very, very old injury. I also have scoliosis. So I've got one hip, here's here. I'm supposed to be an inch taller. I'm 5'9". I'm supposed to be 5'10". And if you could see my waist. My waist is a little compressed because that's where my curve is. I've got an S curve. Well, what that means is that I have one hip that's kind of rotated this way, while the other is rotated backwards. And that also is going to tweak my pelvic floor. All right. Not my fault, not your fault. You have done nothing wrong. This is injury / trauma / other skeletal issues. Okay. What else is in my pelvic floor toolkit? Well, of course, heat. Heating pads work like a charm for me. And the single most important book I have read that taught me everything I needed to know is this book, Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. I'm going to rave and rave and rave about this book. It is filled with case studies, success stories of how they treated patients. So as an example, see, look at this. That's what I opened to. that when you sit on a bicycle seat, you can see that pushes directly up into nerves and muscles. It's absolutely fantastic. If you want to see something here, look at the pictures in this are incredible. So I have an area of pudendal neuralgia. My muscle is so tight, it just squeezes a nerve. And I get a vibration in my left glute. Thankfully, it doesn't hurt, but I've had it for 20 years. It comes and goes, comes and goes. Sometimes I wake up in the middle of the night and my whole body is vibrating. It's just like, right? And this book not only helps me understand how that happens. So look at this. This is the nerves coming off the sacrum, the pathway. And you can see the nerves going under and over various muscles. It's a close-up. See that? You see how that nerve is going in and out of that muscle right there? So if that muscle is screwed up, that nerve is going to be screwed up. One of the things I absolutely love about this book is he talks very specifically about, here's a finger, how to work with these muscles right here. Oh, okay. Allergies just hit, guys. Bear with me. We have got allergy season out here in California. It's been horrible this year. Absolutely horrible. Every time I go out, something new happens. My best friend has pneumonia. It's really bad pneumonia. Her allergies have been terrible. Anyway, there's a whole section on how to treat pudendal nerve entrapments. I cannot rave enough about this book. It will teach you everything you need to know about the different muscle groups, how they get injured, what to do when they get injured, how to calm nerves down, what therapy looks like, etc. One of the things he talks about in this, and he is the guy, by the way, ironically, no doctor ever asked me about tailbone injuries. No one, not a single doctor asked me about it. And then I read this book when it came out, and he starts talking about tailbone injuries. And I'm like, oh, wait, I had one of those. And then, his discussion is just exceptional, right? And I'm going, oh my God, wait. I had a tailbone injury. My symptoms started that year when I had frequency urgency. That must have been my triggering event. And the irony is that I was in a big meeting with some of the top urologists in the country that same week. I'll never forget it. And so we were in a big Zoom meeting. I don't remember. It was like a National Institutes of Health IC meeting or something. And I held the book up to these doctors and I said, guys, this is an outstanding contribution to the field of pelvic pain, Dr. Jerome Weiss. And everybody already knew who Dr. Jerome Weiss was. He's beloved. And then I said, so his discussion of the tailbone is quite fascinating. I've never seen a single IC book expert ever talk about tailbone stuff until this. And one of the doctors went, Jill, we've been talking about tailbone for 30 years. And I went, where? I've read pretty much everything published on IC. I've got every book ever written. I've read them all. Where? And he's like, oh, good point. He's like, well, we've been talking about it amongst ourselves. It's like, yeah, maybe we need to start educating the patients about the role of these symptoms too. So anyway, if you read this, I guarantee you will know more about this than most of your doctors. And it is an absolutely fantastic book. And Dr. Jerome Weiss, who is now in his 80s and retired, is a love. Took him 15 years to write this book, and he wrote it as his the last gift to the pelvic pain community because he wanted us to have something once he's gone. And so, okay, so that's important. That's a critical part of my pelvic floor toolkit. And then again, I'm going to bring this up because now that we know that tight muscles compromise nerves become very inflamed, we get neuroinflammation. So for every one of us who are neuromuscular patients, and again, that's 85% of us, doing something that calms nerves down just makes sense. This makes way more sense for this patient population than Elmeron or Allo or anything like that, because we're focusing very specifically on muscles and nerves, okay? So those are my essentials. There's one other thing. Well, I'll save it for another meeting. Again, we're covering urethral flares, we're covering neuralgia flares, we're covering estrogen atrophy flares, we're covering rectal flares, all of that in a new flare guide that is imminently coming out. All right, let's go. Let me grab my drink here. Hold on. I haven't drunk enough water yet today. I mean, I hit the gym this morning at 8, and yet I just hadn't drunk enough. So bear with me here. And now my nose just started running from allergies. All right, Marlia says, I was using 0.01 estradiol cream, 3 back-to-back UTIs. Want to switch to a 0.05 compounded C estradiol cream. Is that not as strong? No, it's stronger. How does my doctor write the script so that nothing in it will be irritating as I'm super sensitive? All I need to do, I mean, honey, you can't make decisions like that. You can't just arbitrarily say, hey, I want more estrogen. Because there are long-term consequences and systemic consequences to using a lot of estrogen. Most importantly, a systemic estrogen, oral estrogen, can increase your risk of cancer. Normally, what they would do is, if, let's say you were doing 0.01 estradiol 3 times a week, do that for a couple months, go back, let them look at your skin. If your skin is still showing significant dryness, then they might say, okay, instead of 3 times a week, let's do 5 times a week. Let's do that for 2 to 3 weeks. You super saturate the area for the short term, and then come back and revisit it again. You know what? I know why my nose is running, because I picked these flowers out of my garden. You know what? I got to put those outside. I'll be right back. Normally, I'm okay with Alstroemeria, but I think that it's just brought in a lot of extra pollens. Okay. Amanda said, I received my lactoferrin bottle 2 weeks ago from the IC network. I cannot tell you yet if it's helping, but it's early days. And honey, they're not, lactoferrin is not a vitamin. It is a supplement, and it is actually a protein. It's not a vitamin at all. It's a protein. Maria says, thank you. I'm trying to stay hopeful. I've been in a horrible bladder wall flare for a couple months now. Tried bladder installations that had helped me before, but this time they flare me more. I feel like I'm finally seeing my answer, but of course I'm scared I'll be able to tolerate the new cream prescribed. You got to give it a try, hun. Liz says, having my urostomy in August. After 30 years, I will finally have relief from my IC. There are many of us in the IC2 urostomy on Facebook group, and everyone is pain-free. I'm so glad that I live close to the experts at Johns Hopkins. Liz, I truly wish you well. Guys, just understand that surgery is a last resort for IC patients. If you look in our guidelines, it's basically the final option. And this is really only done in patients who have not responded to other therapies. They incredibly expanded the discussion of surgery in the 2022 revision of our national guidelines. One thing that they say flat out, the experience of the surgeon has to be exceptional. This is, you want to be with somebody who, a surgeon who has done this many, many, many times. So the more experienced the surgeon, the better the long-term outcome for these patients. And that's the first time they'd really ever talked about that. The patients who were the considered ideal candidates were patients who had Hunner's lesions that did not respond to therapy, and or patients who had a fibrotic bladder, a very small shrunken bladder, very scarred bladder. The patients they did not consider candidates for surgical procedures are patients who had tight pelvic floor muscles or pain outside of the bladder, which is a sign that nerves are involved, because of course, manipulating your bladder doesn't change the nerves at your spinal cord. You know, and if your symptoms are being driven by nerves from the spinal cord to the bladder, then, you know, yeah. But anyway, I truly wish you well, Liz. And I hope you'll come back and I really, really want to hear how you're doing. I want to hear how it goes. Lisa says, good luck, Liz. I'm almost to that point, since I don't think cyclosporin is right for me. After that would be a bladder removal. I couldn't relax with a finger up my bum, so not sure if I could do that or not. Lisa, it doesn't have to be up your bum. It can be up your vagina. And girl, if you're seriously considering bladder removal and you have not done pelvic floor work, that is a massive mistake. Pelvic floor physical therapy is the single most effective treatment we have, and that's by research done by the U.S. National Institutes of Health. We have a clinical trial, multi-center trial, which showed that I think it was 70% or more IC patients who did myofascial massage had a significant reduction in their pain. That's twice as effective as any bladder therapy. So if I were in your shoes, Lisa, I mean, listen, I begged my doctor to take my bladder out when I was 33. I just said, take it out. I don't need it. I was in so much pain. I was desperate. Just take it out. And he said, Mark Klein, thank God for Dr. Mark Klein. He said, no, Jill, you haven't even done anything yet. I'm not going to take out your bladder. And of course, my answer was, all right, what are we going to do? And that's when we started treatments. And then once we knew to check the muscle, that's where we found my problem. And muscle therapy healed me. It cured me pretty much. Listen, my IC is gone, my IBS is gone, my vulvodynia is gone. They're gone. Now, if I tweak my muscles, they can come back. But if I keep my muscles healthy, I'm good. But I don't have a bladder disease, and that's where we may be different. We may be in a different phenotype. If you're in the Hunner's lesion group, I'm not in that Hunner's lesion group, and that's where we would be really looking at surgical alternatives if you're not responding. But again, now we got the lactoferrin, which showed that red inflamed bladders became pink and healthy, and Hunner's lesions almost completely disappeared. So that's something else that you can try. And you can find all that research over on the IC Network website. It's like literally on the front page. There's an article on lactoferrin and there is an article on PEA. I have links to all the research so that you can look at those research studies yourself. I'm very, very excited about that. Liz says, I get so frustrated with so much attention on the pelvic floor. 25 years ago when I was diagnosed, it was all about defects of the bladder, mast cell, defective gag layer, extreme irritation of the bladder wall with massive areas of glomerations. What happened to us? Sitting on a bike or motorcycle is not going to cause a problem in the bladder wall. Honey, that's where you're wrong, girl. Listen, you're wrong. No. So nothing operates in isolation in the pelvis. The bladder is not this separate entity that operates on its own. Nothing operates in isolation. Everything influences everything. So, for example, the nerves are shared because the nerves all come from the sacrum. They all come from the same root. The same. Oh, come on, what's the name of it? Anyway, the nerves are shared up at the spinal cord, and that when that pudendal nerve comes down, it innervates the vulva, it innervates the clitoris, and it innervates the tissue down there. So nerves are shared. We have something called neural crosstalk. We know that if the nerves in the bowel get irritated, the nerves in the bladder can become irritated. We know if the bladder wall gets irritated, the nerves in the bowel become irritated. So nerves are an entity we have to consider. And at the same time, if not more so, we have to look at muscle health. Because the fundamental flaw here is all those nerves and blood vessels come through the muscles. And if those muscles are screwed up, what are they going to do? They're going to squeeze them all. If your bladder is supposed to get 24 units of blood a day and it's only getting 10 because your muscles are so tight, are you going to have a healthy bladder wall? And the answer is no. There's no way. This is called ischemia or ischemia. So that's what I was in. I was in a state of pelvic ischemia. My muscles were so tight, they had virtually, it didn't shut down blood supply, but blood supply was massively reduced because my muscles were so tight. Did that directly affect my bladder? Absolutely. And the reason why pelvic floor physical therapy is so incredibly important is that it restores proper blood supply. Our therapeutic priority for those muscle patients is to get those muscles to relax enough so that they stop squeezing blood vessels and nerves. And then we've got good blood supply, which means the bladder is now getting all of the oxygen, all of the nutrition it needs to be healthy. The bladder wall defect theory has been obliterated by our phenotyping. Okay, so if you look at the 2022 revision of the AUA guidelines for IC, they say there are distinct patient groups. We are not all the same. And you can't put apples, oranges, and bananas on the same treatment and expect everybody to get better. It doesn't work that way. So today, the very first thing a doctor is supposed to do is to figure out what group you're in, because your group determines the right treatment for you. So I use the system that Dr. Christopher Payne, who ran the IC research program at Stanford, that he proposed. He proposed this 7 years ago. And here's what he said. He said, here's the problem. When a patient is diagnosed with interstitial cystitis, the patient, and really most doctors, don't know what to do. There's no clear treatment plan. And he compared that to cancer. He said, patients who are diagnosed with cancer, they're just not told that they've got cancer. They're told you've got cancer of the left breast and it's estrogen dependent type 1, 2, 3. And based upon that very narrow diagnosis, both the patient and the doctor know exactly what to do next. And he said, how do we give that to an IC patient? By giving them a more detailed, individual diagnostic workup. So he proposed 5 core phenotypes. Curtis Nichols using 9. So in the pain system, which is what I use when I coach patients, Hunner's lesions is one group that's now linked to viral infection. Bladder wall driven chemical injury from chemotherapy, that's an injury to the bladder wall. Bladder wall driven estrogen atrophy, that's a dry gag layer. That's not a defect in the, well, we could say that's a defect in the gag layer, but we know why it's defective because there's not enough estrogen for the bladder to produce mucus. We're also going to look for chronic infection, but we're not just going to look for chronic bacterial infection. We're going to look for chronic fungal and chronic viral infections because we now, again, from our own U.S. National Institutes of Health, have found increasing levels of candida and fungus in our bladders. Why does that happen? Because we've all been over-medicated with antibiotics. Okay. Our third phenotype is our biggest phenotype. That's pelvic floor driven. 85% of IC patients have tight pelvic floor muscle. And we have to understand the legacy of those tight muscles, that when you've got tight muscles, you are in a state of ischemia that is going to affect your bladder and give you frequency urgency. We have a new diagnostic name for that. It's called myofascial frequency urgency syndrome. We had a study like 2 years ago, and they were like really trying to correlate what causes frequency urgency. Is it the bladder wall or is it the pelvic floor? And that study actually said frequency urgency is far more frequently triggered by the pelvic floor as compared to the bladder wall. Okay. Pain's fourth group is pudendal neuralgia. This is a nerve injury. Patients who have these patients have positional symptoms. They're fine when they stand, but when they sit down, it hurts. When they bend over, it hurts. They might have areas of numbness, pins and needles. They might have PGAD, where you feel this painful arousal sensation. They might have sciatica. Okay. With that, again, that's not a bladder disease at all. That's a muscle squeezing a nerve. And so therapeutically, our goal is to figure out what nerve is being squeezed, where it's being squeezed. We want to release the pressure where it's being squeezed, and we need to calm the nerve down. And then our last group in the pain system is a widespread pain. IC, IBS, vulvodynia, TMJ, fibromyalgia, migraines, etc. I'm in this group, characterized by having a very sensitive skin, a wicked sense of smell, incredible hearing, sensory, that our senses become very sensitive. What does sensitive mean? It means that the nerve threshold is dropped so that it's easier to turn the nerve on. That's all. That is injury. We now know what that is. That's not a bladder disease. I did not have all these weird painful diseases back in my 20s when I was just like every year, what the hell is going to happen next? You know, and it was very depressing to have all this progressive pain that made no sense to me. Well, now we know what that is. That's an injury to the central nervous system. And we know why that happens. That what the research shows is that for 80% of the children who develop widespread pain as an adult, there is a history of a major injury. Like, hello, falling and breaking your tailbone. I've worked with people who have been hit by cars. I've worked with people who, I mean, you name it, the injuries are real. And the other 20%, it's a history of abuse or bullying. The commonality with all of these patients, which is just so interesting, is they all have anxiety. We all have anxiety disorder. You know, we've known anxiety was very common in the IC patient population, but anxiety is classic in the widespread pain phenotype. Again, because of trauma, physical trauma, or it could be, you know, childhood trauma. I have shared that I grew up in a neighborhood with a kid who became a rapist or murderer. I didn't leave my house without fear for a decade. It's that easy. I was attacked many times. The year I went away to college, he raped and murdered my neighbor. We all knew it was happening. They just couldn't stop him, you know, until finally he did something so horrific that he went to San Quentin. So think about what that did to my central nervous system. That's an injury. That's what we call a childhood adverse event. And it's really the best way to think about this is, how does a child's brain respond to trauma? Because this is not mental illness at all. This is about, how does a young child's brain adapt to long-term persistent stress? It becomes more sensitive. sensitive skin. Aha, that's another sign of a brain that's become more sensitive because our brainstem's just trying to save our life. It's making us more vigilant. I mean, that's a whole nother story. I could go on and on about that. But anyway, that is 40% of the IC patient population fall into this group. Now, Nickel has several more. He has a urethral pain phenotype. He's got uh, um, a frequency urgency nerve syndrome phenotype, small population. Anyway, there are more. So it's not that people are ignoring the concept of a damaged bladder wall at all. Today, we're just understanding why that happens. And also, it's important that you know that petechial hemorrhaging glomerations are thrown out completely as being meaningful. 20 years ago, we thought that was IC. Today, we now know that that's what happens when you stretch the bladder. They're not unique to IC. You can take somebody with no urinary symptoms at all and do a hydrodistension, and they'll have petechial hemorrhaging. So a lot of that information that we all got 20, 30 years ago, it's thrown out. It just is. Judy says, does the vagus nerve affect the bladder? I think indirectly, yeah. But I can't give you the specifics. I haven't studied that. I know for me, I definitely went through a period of time where I was having problems with my vagus nerve. And it was back when my IBS was really, really bad. And I would get a wave of nausea, a wave of vertigo. And then I'd have an IBS, then I'd have to run to the bathroom because of the IBS. And then after that, I would have like another really big wave of nausea. That's completely gone now, but I don't know enough about that to be able to give you more information on that. Ray says, flares from trying bladder installations, how long could it last? Did I screw myself even worse for good? No, nothing is for good, girl. Come on, your body's trying to heal anything that's happened, and you can't blame yourself for trying something that might have bothered you. It just happens. Lisa said, I'm trying lactoferrin and I do have a bladder issue. Okay, got it. I mean, we all had bladder issues. The question is understanding what's the underlying trigger for the bladder issue. You get that, right? Amanda said, all of my inflammation was in the trigone via my cystoscopy. My new urogynecologist just started me on estrogen cream. I'm hoping it will help. I'm 40, I have constant urge. Pressure and frequency started a year and a half ago and never went away. That's pretty interesting. So the trigone in the bladder is the most hormone responsive tissue in the bladder. Amanda, I would ask you, number one, are you still having your periods? Are you on birth control? Anything going on that you think might have limited your estrogen levels? Marlia said, just got my lactoferrin powder started yesterday. It comes with a little tiny scoop. Is that enough? Yes, because that matches what's in a capsule. It's meant to be a tiny amount, honey. It's meant to be a tiny amount. It's not a lot. It's always easier to take capsules rather than the powder because unfortunately, the reason why you put it in a capsule is the capsule helps it resist stomach acid. It helps it pass through the stomach and get to the intestine where it can get absorbed. When you're taking the powder, you don't have a capsule. So your stomach acid is going to destroy a good chunk of that powder. I need to calm my bladder to calm down. You have such bad atrophy. Hopefully using estrogen and PEA and lactoferrin will help. I think it should, hon. I think it should. Peggy says, "Hello, Jill. You look wonderful. I hope you're feeling better." I am. I'm wearing a dress today. Um, I'm not feeling, again, I'm just dealing with these incisions on my chest wall. So Lisa said, "I totally respect everything you say, but I've tried every conservative treatment. I'm in a more than one phenotype and I have a true bladder disease. I come here for help, not a lecture. Please forgive my honesty, but my pain is horrible and I'm not sure what else to do." Lisa, honey, I would love to talk to you if you're ever interested. Just, it's free, of course. Um, Bladder disease, we have to be, there's this kind of general perception that this is a bladder disease. So let's talk about bladder, the different types of bladder diseases we can see. So the first thing we want to look at is autoimmune disease. So if you have Sjogren's, if you have lupus, there is certainly a small chunk, maybe 3%, according to the latest research, that shows that there could be an autoimmune component to bladder symptoms developing. Okay, so that's one bladder disease, absolutely worth considering. Again, about 3%. The second thing we want to look at is something like Lyme disease, Borrelia. So that's been found in the bladder. So we want to rule that out. We want to look for other pathogens. So, and again, the perception here is that we all have bacteria, but what our biome studies have identified are fungus. And again, that's the US National Institutes of Health who made that finding. And so having a next generation DNA urine test to look for fungal infections, not a bad idea. We also want to look at viral infections because, again, next generation testing has identified Epstein-Barr and polyoma in the urine of patients who have Hunner's lesions. Those are genuine, absolute diseases. And then, of course, we have rare diseases. You could have, oh God, what was it? There are a couple, somebody sent me, I've had two people now send me their next generation DNA urine tests that had bacteria that were so rare and so unusual. And they both started with an M. Morganella was one, I think, and I forget what the other one was. And the question then is, how the hell did they get exposed to that? I mean, really, one of them, the last one was very common in hospital-acquired infections. So they are often exposed to this in hospital settings. And then let me just throw out another interesting disease that we have correlated with this, and this is going to blow your mind, black mold. That if you have black mold in your home, black mold is also known for affecting the urinary tract. And we had one patient contact us. Everybody in their house was sick with different things. Mom had been diagnosed with interstitial cystitis, terrible urinary symptoms. And eventually what they found was that the mat underneath their carpet, the padding underneath their carpet throughout the entire house was filled with black mold. That the water heater had just been leaking, I guess, apparently for years. And this was a newer house that they bought. And it was this like environmental catastrophe. and they all had to move out of the house and do this extreme remediation to try to remove all of that black mold. So, and then there's one other thing. Lisa, I'll throw out the latest thing. Dr. Ann Ackerman, UCLA. So, everybody has looked for years for, quote, a smoking gun bacteria that they thought caused IC. This goes back to the University of Maryland. Jack, what was his name? He was a big IC researcher there. I forget his last name. Anyway, so, the assumption was 20 years ago that maybe it was just an infection nobody could find. And so people started looking for that. And nobody found anything. And then now we have all this new DNA testing where they take a sample of urine, they spin it up, break everything in pieces so that all that's left is DNA. And then they can profile your biome based upon the DNA fragments they find. So starting about 10 years ago, they started looking at our urine from a DNA standpoint. And what all those studies found is normal biome, less diverse, more lactobacillus than normal. And of course, lactobacillus is considered good bacteria. So multiple studies, just several studies, including Curtis Nickel, as top IC researchers in the world, they all did biome studies and they all found normal biome, less diverse, more lactobacillus. Well, then Ann Ackerman, who is, in my opinion, destined to win a Nobel Prize for her work with biomes. I mean, she's just so highly, highly reviewed. And I've listened to her speak several times. She's fascinating. She said, okay, let me check. And so she brought in, I think, 90 patients into her lab at UCLA. They all gave her urine. And she started doing biome research. And her first round of research found normal biome, less diverse, more lactobacillus. Interesting. But she was the first to go, oh, no, wait a second. Let's look at it based on age. Is it really right to compare the urine of a kid versus the urine of a senior citizen? No, not really, because, our bodies change with age. And she was the first to show that if patients under the age of 45 had a extremely narrow biome, not particularly diverse. Patients over the age 60 had a ton of different bacteria. And that's reflective of menopause. That's reflective of what happens when estrogen drops and pH changes and more bacteria start to thrive in that environment. So she's like, okay, so that's why you can't compare the urine of somebody young with the urine of somebody old. Then she did something really remarkable. She looked at it based upon phenotype. So getting back to this concept of phenotyping. So patients who were pelvic floor driven, normal biome, nothing wrong. Normal, healthy, nothing wrong. Patients who were not bladder centric, patients who had pain outside of the bladder, like in the uterus, were dominant in E. coli. Okay, so again, it kind of makes sense. Patients who were bladder centric, who did not have pelvic floor dysfunction, were dominant in something called Lactobacillus iners. Now, this is interesting because Lactobacillus are good bacteria, right? No, not this Lactobacillus. This Lactobacillus is a pathogenic Lactobacillus. They only just found it like 5-6 years ago as they were what they did is they added blood to a culture medium and this brand new Lactobacillus grew out. There's Lactobacillus iners. They've never seen it before. Lactobacillus iners um, behaves like, think Prevotella. It damages tissue, and it does not do what normal lactobacillus does. It doesn't control fungus, et cetera, et cetera. It literally is pathogenic lactobacillus. So there's our smoking gun for this small group of patients. So how does lactobacillus inners grow? Well, lactobacillus inners, and again, that's INERS, you're welcome to Google it, is actually what we call an opportunistic lactobacillus. It is the first to rebound after somebody takes antibiotics. And it grows so quickly, and it consumes all the native food that it pushes out all the other lactobacillus. So we have research now that's connected lactobacillus inners to bacterial vaginosis. Patients who are dominant in lactobacillus inners tend to have a poor long-term outcome. Patients who are dominant in lactobacillus crispatus have a very good long-term outcome. So this is the third year. She's now one of the teachers of the IC class at AUA, which just happened. And she shares all the latest research, but she ends the class literally begging urologists to stop prescribing antibiotics for any random thing. And she said specifically that you are not understanding the long-term outcome and damage that antibiotics do to the biome. So we can call that also a bladder disease, a man-made bladder disease, because that's what happens when somebody takes a lot of antibiotics over time. So I am not at all negating the role of bladder disease. We're just now trying to put it all into context, because every damn bladder treatment clinical trial has failed. $100 million in research failed. The only study that succeeded was a physical therapy study. And so, the IC world is now, I'll just end this with this. We are having a lot of discussions at the national level about clinical trials, because we know, how are we going to get a new pharmaceutical company to take interest in IC when every previous pharmaceutical study has lost millions of dollars? How do we attract somebody to this environment? Well, you can't put apples, oranges, and bananas in the same study and expect success. It doesn't work that way. We have to phenotype. And we've got to get patients in this distinct group. Hunner's lesion patients deserve their own damn research. Autoimmune patients deserve their own damn research. Viral infections need their own research. We can't keep mushing them all together. It's going to fail. I've gotten into big, we had big discussions, and I'm pretty assertive in these discussions. I'm like the only non-doctor planning some of these research studies or creating guidelines for these research studies. But it helps that I've got my degrees in pharmacology, drug development. So. Aaron said, I'm convinced the lactoferrin triggered your IBS. Anything I can do to return this? Yeah, honey, just do me a favor. Just call me tomorrow. I'm not going to have you return it. Just if you can call me or give me an email, I'll give you a refund for it. It's not a problem, but don't return it. There's nothing we can do. We can't resell it. You're not, that of the side effects for lactoferrin, the vast majority of patients, and again, in the IC study with lactoferrin, there were no side effects. But There are certainly some patients who can get gas and some bowel distress from it. I mean, we've certainly seen that, and so that's fine. Just call me, and I will give you a refund. Patricia said, if I'm somewhat dairy sensitive, should I try the lactoferrin? I seem to be able to eat some dairy. I think so, honey. I think you could. There's not enough lactose in it to cause a lactose reaction. And again, the great majority of patients out there who've tried it, we've got some patients who are doing really well on it. And again, there are others, yeah, you do it a couple of months, just if it's not making that much of a difference, and move on. And again, in the end, you have to phenotype first anyway. This is all we don't want to just throw we don't want to take the kitchen sink approach to treating our symptoms anymore. Today, we're trying to do a very narrow diagnostic workup so that we can narrowly define the treatments that have the most chance of helping you. So if, for example, you're pelvic floor driven, there's no reason to do the lactoferrin. Amanda said, I have urethral pain, but mostly 24/7 urgency, frequency, and pressure. It feels like a constant UTI. So Amanda, then again, you need a proper phenotyping because pelvic floor muscles can cause frequency, urgency, pressure, but so can the bladder wall. And so we got to try to figure it out. It will feel like the world's worst infection coming from the muscles or the bladder wall. Mine was all muscle driven and it felt like the world's worst infection. Hey, Kathleen. And Kathleen said estrogen helped her tremendously. Awesome. Love it. Hi, Chloe. Chloe says, happy Sunday. Erin said, thank you very much. You're welcome. Honey, just be the squeaky wheel, okay? You can pop me an email, icnetwork@mac.com, or call me. We lost my main employee up in our store, got another job. She got a great offer. And so I'm back to doing a lot of store stuff. Lisa says, sadly, some insurance companies will not cover DNA urine tests. You're absolutely right. And yet what was so interesting is Curtis Nickel, again, one of the top IC doctors and one of the top urologists in Canada. He was the chairman or president of the Canadian Urological Association. He gave a lecture on next generation DNA testing, where what was it? It was like when they give these special speeches, it was like the something state of the art lecture something. Anyway, he spoke to thousands of urologists, and he just said, guys, next generation testing is far more accurate than urine cultures. That is the future. That's what we need to work at. I thought I saw another message pop up there, but then it disappeared. All right, you guys on YouTube, you're pretty quiet. We are simulcasting right now on Facebook and YouTube because I got my second internet back. Yay! Let's see. Amanda said, I did do pelvic floor, but was told my pelvic floor was fine. Through all my testing, the only thing they found is a trigone inflammation. Okay. So, trigonitis, which is what some doctors would call that. That would be bladder wall driven trigonitis, which would be a tiny, tiny subtype, but it's real. It happens. There's been a lot of debate and discussion about trigonitis because what happens, because this is a distinctly different type of tissue, so the triangle is the entrances for the two ureters down to the bottom of the bladder to the urethra. So it literally is a triangle, which is why they call it a trigone. It can be smooth or it can be bumpy. It can be so bumpy it looks like cobblestones. And I can remember when I was building the IC network and we were doing a lot of research on this, there was a lot of discussion about, are those bumps normal? Some doctors just chose to laser them off. Some doctors thought that was a sign of inflammation. Other doctors said, yeah, that's a normal trigon. Not really going to mess with it and traumatize the bladder even more. To me, I would be doing, hold on, hold on a second. Okay. This book, Facing Pelvic Pain, was done by Harvard. And it is the book for patients who don't fit the normal kind of model for IC. For a patient that, if we, let's see, how do I want to say this? There are patients out there who are complex. There are patients out there who don't fit the mold for one reason or another. And this book has chapters on all the different systems that can trigger them. In fact, I just opened it up to what are the rheumatologic, neuroinflammatory, and vascular pain. And it literally opened it up to ischemic pelvic disease. Oxygen is necessary for virtually all body cells to survive and perform their respective functions. Yada, 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 yada. Ischemia can present as both acute or chronic, with the latter being the most common, ischemic pelvic disease. Yeah, okay. So anyway, so let's see what they say in here about trichonitis. Do they even talk about it? They don't. Okay, hold on. It doesn't mean they don't, it just means it's there. So let me go to what urogenital problems can lead to pelvic pain. And let's see if they talk about this. Oh, I wish I had a PDF of this book so that I could just search for the word trigon. Give me a sec. I just want to, I mean, there's no better book than this one. Man, I can't believe they didn't talk about it. Shoot. Hold on. All right. Okay, so we're going to the $200 textbook. Let's see if this one okay. Oh, there's a little section on it. Hold on. It's talking about Botox into the trigon. Okay, that's not helpful. Hold on. Last but not least, we're going to go to the European textbook on IC. Let me see what these guys have to say. Page 323. Yep. Same thing, Botox. Most urologists inject the toxin into the trigone on the basis that this is where sensory afferent nerve concentration is greatest. This may also minimize the risk of postoperative urinary retention. One group who injected the trigone alone reported no problems with urinary retention, whereas those groups who injected the trigone in other areas of the bladder showed urinary retention 3 to 18%. All right, well, see, look, that tells you, Amanda, that tells you that the 3 biggest books do not have not explored this in depth because there is such different perceptions among doctors about the trigone. There just is. I guess if I were in your shoes, clearly you have inflammation there. They saw the inflammation. So I think you've got to ask, what can I do to make my skin as healthy as possible? So if you're showing any signs of estrogen atrophy, that's going to affect the trigone. So doing that topical estrogen would be meaningful. I think the second thing that I would do is I would be asking myself, am I introducing anything on a daily basis that could cause some of this irritation, inflammation? And so that's where I would, for 3 to 6 months, lock down your diet and really restrict your diet to those bladder-friendly foods or maybe the triad foods. Just avoid all the coffees and sodas and the green teas and matchas. Avoid all those. Just do everything we can to try to make your urine as pristine as we can. It might be interesting to do next-gen testing just out of curiosity more than anything else, but I mean, I can't imagine infection only affecting your trigone and not the other parts of your body, so that doesn't really make as much sense. Is there any chance that we've got anything else in your pelvis that's triggering some neuroinflammation? Do you, for example, have HPV or herpes? Do you have tight pelvic floor muscle squeezing nerves, et cetera, et cetera? I wish I had better information for you, honey. I really do. Lisa says, I need your help battling a UTI while taking anastrozole. Amanda, the other thing I can do is I can actually write up case notes and send them to the top doctors, which I do frequently. So whenever I encounter a patient that's very, very complex and very unusual, we will pop that over to some of the top docs for their suggestions. And your next generation DNA testing came back negative. Okay, that's great. That's great. Okay, so we can completely rule out that. Are there any environmental toxins? Do you have a smoker in your home? Are you exposed to secondhand smoke? Again, black mold? I mean, something is tweaking your trigone. There's no doubt about that. Hmm. Let me do one other thing. Hold on. Let's just go to the National Library of Medicine and let's just see. And Lisa, hold tight, honey. Hold tight. Let me just see if we have any new research studies that have been published on True United. It's giving me animal studies. Hold on. What? The impact? No. Ectopic prostate tissue presenting as a bladder tumor in a young man. This report discusses the case of ectopic prostate tissue identified in the bladder trigone of a 31-year-old patient who presented with lower urinary tract symptoms. Imaging studies revealed a suspicious lesion within the bladder that they originally thought was cancer. It turned out to be prostate tissue. They can say that ectopic prostate tissue is a rare pathological condition that can present with clinical features resembling various bladder symptoms. So that's kind of interesting, but you're not a guy. So, although we do know that endometrial tissue can migrate into the bladder, but I would think they would have seen that. They would have seen that if you had a cystoscopy. Let's just see if there's anything else. See, there's also a trigone in the heart, and so it's giving me heart studies. Hold on. I'm just not seeing a lot, hun. Whoa. No, that's a birth defect. Okay, so okay, is trichonitis a neglected, imprecise, misunderstood, or forgotten diagnosis? Okay, this is interesting. Cystoscopic evaluation of the trigone described inflammatory lesions of cystitis cystica, occasionally small stones or pus-filled lesions, in appearance that can be differentiated. Okay. Um, his, okay, embryologic formation of the trigone, in other words, a birth defect. History of recurring UTIs and effective hormones on the trigone have been proposed as underlying pathophysiologic mechanisms. Numerous therapeutic strategies have been reported to treat symptomatic trichonitis, including antibiotic therapy, intravesical instillation, electrofulguration, and laser. However, no treatment indication criteria has been well established so far. Despite several reports, okay, I'm going to give you this. I'm going to give you a link to this paper. And it's just the abstract. This is from 2019. It might be interesting to buy the paper and read it. You know, we are allowed to see abstracts, and a lot of articles are free, the full text, but others, the medical associations have to make money, so they charge for it. Cystitis cystica and recurring UTI seem to be more common along with estrogen things. So, she said, no smoke, nothing new, living in the same house for 20 years. I've been researching and trying everything for a year and a half since it started. Strict IC diet for a year, seen 7 different doctors, had installation supplements, nothing has helped, and the doctors just don't know what else to do for me. I'm on my own with this. They've given up on me. Girl, you are a warrior. You are the epitome of an icy warrior. So, did you do aloe? Aloe is soothing. I mean, we just kind of have to tackle it from different perspectives, right? So, we've got the infection perspective, but your testing came back normal. So we don't need to waste money there. So let's go to that inflammation perspective. That's where the lactoferrin might help. And just out of curiosity, aloe is known to being very soothing. Did you have any effect from aloe? Okay, let's go back to Lisa to Mar. Okay, Marlia said, took antibiotic a lot for UTI. So if I were to have lactobacillus inners, how can I fix it or heal that? It's about making sure you're on a really, really good probiotic to balance out the bad lactobacillus with good lactobacillus. And that's an area of study right now. Lisa said, so let's get to Lisa here for a moment while Amanda's answering that question. I'm battling a UTI while taking anastrozole. I have to look it up. Hold on. I want to know what the side effects of anastrozole is. All right. So anastrozole is used to treat hormone receptor positive breast cancer. So from one breast cancer patient to another, Lisa, a big giant hug. You know, you're also a breast cancer warrior like I am, but you're a big better warrior than me. So the reason why you're more prone to infection is because your bladder does not have the estrogen it needs to produce mucus, which your bladder would normally use to repel the bacteria. So, did they identify the infection for you? Was it E. coli, staph, strep, Klebsiella? Um, it's a tricky situation. You could do Prevent or Allura. Those are the two over-the-counter supplements that are considered kind of the best over-the-counter supplements to try to prevent infection. Um, but it would be nice to know the type of bacteria it is because we could look at that. Also, doing a next generation DNA urine test would give us your drug resistance genes. That would be helpful. You're in a pickle. You're in a pickle. So really what they have to do is they have to identify the bacteria correctly. They've got to look at the drug resistancies and get you on a regime which will kill that bacteria and then get you on something that's maintenance that will try to prevent that bacteria, like again, D-mannose or Allura or Prevent. And along with avoiding those things that we know can contribute to infection, like being in bathtubs, being in hot tubs, things like that. You're vulnerable right now. And I was thinking about that this morning. Amanda says she's been taking Desert Harvest Aloe for about 6 months and added pumpkin seed oil in my routine a couple of months ago, and you just started the lactoferrin 2 weeks ago. Well, are you better today than you were 6 months ago? Ariella said, been doing okay with hydroxyzine and avoiding tomatoes and other triggers. Aloe vera helps when I flare. Yeah, good. I'm glad it does. And again, the aloe that we are suggesting now is Aloe Path. And that's because it has PEA in it that can calm nerves down. So it's like taking that soothing effect to another level. The aloe itself soothes the skin, the PEA soothes the nerves. It's a really good combination for bladder wall flares. So Amanda, are you better today than you were 6 months ago? Are you the same or are you worse? And guys, I always make this offer. If anybody wants to go into Zoom, we can go into Zoom too. It's fine. But it is a holiday, and sometimes people want to talk and sometimes people don't. Completely up to you. I am here at your pleasure. Yeah, I feel kind of bad. I want to go back and I want to send a message to Lisa. Hold on a second. Okay. All right. So let me do this. All right, guys, hit me up. I'll take any questions you got. Hmm. Interesting. Anybody have? Okay, here, hold on a sec. Peggy said, ASO double strength really helps me when I flare. It numbs the bladder wall. I take it at the first signs of a flare. Yeah, I should have put that in my little flare kit. This is a good idea. I just have to say, ASO honestly never helped my flares. But again, now we know why, because I have a healthy bladder, that my flares were all being driven by tight pelvic floor muscles. Chloe said, what's the new research on probiotics? I can tell you, I'm just starting to work with a new company that has created a product to balance the biome after antibiotic use. And we will be launching that soon. And so, mark my words here. In the future, we will be treating bladder infections with the correct bacteria that will control that pathogenic bacteria. Just like we will be treating fungal infections with the correct lactobacillus that will kill that fungal infection. Because ultimately, in the end, our bodies, is our body's biome is held in check with a healthy population of good beneficial bacteria that keep the bad stuff in check. And so, and the reason why we're so screwed today is because of antibiotics destroying the entire biome. And throw in a horrific diet, which is dominant in sugar, which fungus feed on, which then completely disrupts everything else. And oh God, something just popped through my brain. What was that? It was a new research study about, oh yeah. So they were looking at a damaged biome in the bowel and making a direct connection with urinary symptoms. And how, if I remember correctly, and I think I have it saved to be Errol. Let me see if I saved it. I think I saved it. Hold on. Normally I would put it up on my article idea thing. Hold on. Let me see if I saved it. No. No, I didn't save it there. Yeah. Okay, hold on a sec. Tina said, what do I think of the Garden of Eden probiotic? Let me look at it. If it's got Lactobacillus crispatus in it, I am all on board. Lactobacillus crispatus is kind of like the superstar of good bacteria. All right, so let's take a look here. So they've got the once daily women, 50 billion. Let's look at the vaginal care one. "38 probiotic strains." Well, show us the strains. What are the strains? Oh, here we go. Girl, that's a ton of lactobacillus. Wow. But it also has a Eastern European raw fruit and veggie blend, including red bell peppers, green pea, carrot, plum, strawberry, and raspberry. It doesn't have Lactobacillus crispatus in it, but it's got pretty much all the other ones in it. I don't know. I think that when I look at lactobacillus products, I just want to mix it up over a period of year. I don't want to keep taking the same brand over and over because I want to populate my body with multiple strains. That's a pretty robust probiotic. Sandra said, is Allopath available in Canada? We can send it to you in Canada, but we did get a notice of a new mail strike. Sandra, something about a new mail strike supposed to hit next week. Did that get settled, or is that still happening? So we got a big warning from our postal service about shipments to Canada with a pending Canadian mail strike again. Chloe says, I always thought there must be a way to treat an infection by bombarding it with healthy bacteria. Glad that seems to be the way the research is going. Yeah, it definitely is. Tina says hers is 40 billion CFU. Yeah. Just remember that you want live bacteria, and the really the best sources of probiotics are going to be kefir and yogurt. That's living bacteria. Jennifer says, how can next gen testing help those with IC? What does it test for and who should get it? So, next gen testing, so remember, you are an anatomical mystery to be solved, right? Okay, so our goal here is to try to figure out what's driving your urinary symptoms. And literally, the very first thing people look for is infection. And a typical urine test is a urine culture, and that's where they have what we call an agar medium, a culture medium. It's like jello. It's like nutritious jello that they will put your urine on to see what grows. The problem with a urine culture that way is that not every bacteria eat the same food. So a urine culture only selects out for the bacteria that eat that specific food, which means that it's going to miss 90% of the other potential bacteria. So next generation DNA urine testing is a way of ruling in or ruling out more complex infections. There are patients who insist, they absolutely insist that they have an infection, even though culture after culture after culture after culture comes back negative. Now, of course, the most doctors only do cultures. Most doctors are going to say, I'm sorry, your cultures are negative. I'm not going to give you any more antibiotics. And because we know taking antibiotics is harmful also. And so, and yet at the same time, that patient is going, but they always help me, they always help me, they always help me. So a next gen test is a way of validating that patient's opinion. Like I had a patient call me last year who said, I won't take anything but antibiotics. My doctor is refusing me antibiotics. He wants to give me other meds. Like, I believe it's infection. I refuse to take anything else. I will only take an antibiotic. What do I do? And my answer to her was prove it. Then you have to prove it. You can prove it that you have maybe a rare, difficult difficult to diagnose infection. Next generation DNA urine test will find that. And you can use that as evidence with your doctor to say, look, I've got just a smaller rare infection. Here's the lab results. They found it. Here's a recommended treatment. Can we do that? On the other hand, if a next generation test finds nothing, then other than good bacteria, then you have to walk away from the theory that you have an infection. And I told her that. It's like, if that comes back with nothing, then it's nothing. And that's when we have to look at other things. It could be triggering your symptoms, like tight pelvic floor muscles, like a fibroid tumor pushing on your bladder, like a Tarlov cyst, like a viral infection, like a fungal infection. And then that's the other thing that next-gen testing does that a urine culture does not do. It does not test for fungus. And again, we have research from our own National Institutes of Health that has found a direct correlation between bladder pain and fungal infection. The more fungus you have in your bladder, the greater the pain. So, I don't like guessing. I like facts. A next generation test is literally a factual look at the health of your urine and your bladder at that time. I don't want to attach any emotion to it at all. It's just data. That's all it is. It's just data. But in my opinion, it's useful data. I mean, I've had it done a couple of times, and I found it absolutely fascinating. So does that help, hon? Jennifer, does that make sense? Oh, Sandra says they are holding off with the mail strike. Good. I could not believe that the mail strike happened over Christmas. All those Christmas presents and Christmas cards that couldn't get delivered to grandkids and kids broke my heart. That was a beast of a mail strike, that's for sure, and it really affected us. And because all of our orders were sent to an international holding facility in Los Angeles, and then they just sat there for weeks and weeks until they could deliver them. Crazy. All right, guys. Well, listen, we have been going now for 2 hours. I am here as long as you have questions. So let's anybody got any more questions? If you do, I'll take it. If you don't, it's a Sunday afternoon. Let's go do something fun. I wish I could transition this meeting over onto my cell phone and I just take you for a walk with me. Oh, my hair is being so weird today. All right, questions, questions. Last call for questions. Anne said, will estrogen help frequency urgency? Yes, because it will help prevent the nerves from being irritated. That frequency urgency is coming from the alpha afferent nerve in the bladder wall. So our job now is to try to figure out what is tweaking that nerve. Amanda said, not really, but have some decent days here and there, but never a day without symptoms. You know, Amanda, if you call me this week, the phone number is at the top of our website, but it's also right there, 800-928-7496. I'd love to write up your case and send it off to some of the top IC docs and see if they have, some suggestions for you. Okay. Anne said, doctor said to only use a pea size. Yes, you only use a little bit of estrogen. That's okay, just a little bit of estrogen. Pea size drop. That's what I was told to rub into my urethra when my urethra was screaming at me. So that's a good size, my friend. That's a very good size. So what's happening this week? So tomorrow's a holiday. It's a male holiday. So technically we are closed tomorrow. I will probably go up to my sister's house tomorrow. Yeah, Amanda. Yeah, absolutely no problem, Amanda. I'd love to hear more about it, and let's see if we can find some more resources for you. Flare Guide, IC Optimist should be done this week. We're bringing on a couple of new big projects that you will see. Next big project after that is doing an expanded diet guide with our new diet list. The IC and food list was updated for the first time in a decade a couple of months ago. That's now available on our website. It is free. We have a big event in June that I will be participating in for a couple of days. Very excited about that. I can't tell you about that until it's over. Otherwise, we're just kind of getting into the summer now. Praise God, hallelujah, for this cold, wet winter and spring is almost over. I crave sunshine. I just want the sun. Other than that, I will be filming more videos. We have a new videos on IC flares that I've got to do in the next month. We have a fantastic new social media campaign going on, run by Stacy. Really happy with that. IC Awareness Month is in September. Yay, thank you. You guys, if you like what we do, please become a member of the IC network. Just go on over to you can go on over to our shop, and our main website. There's a link at the top. Become a member, and you will get our magazine, the IC Optimist, which is where we do our best work. Marlia says, I tend to be sensitive to Greek yogurt, but due to all the antibiotics I've taken, I need to get my gut biome in better place. Maybe address the lacto-inners thing. So with the probiotics, you still be my next choice because I think Greek yogurt makes my bladder burn. Not necessarily. I mean, if it's not, what about what? So back when I could do saturated fat before I had my gallbladder removed, I was doing coconut milk yogurt. Love that stuff. Felt great on it. So have you tried some different yogurts rather than Greek yogurt? Look at the coconut milk yogurt. See if you can do that one. Sandra says, where do you order the next gen DNA test? At Microgen. Microgen DX for diagnostics. So Microgen, D as in dog, X as in x-ray.com. And they have a bunch of different tests. Let me go there. I just did this for somebody else last week too. So if you go to their website, Microgen DX, just click on place order. And click on I am a patient. And let me just read off the different tests they do. They have the UroKey test, which is a UTI test service. They have, for men, a urine and semen test. For women, they have a urine and vaginal test. They have a straight vaginal test, which I've done. They have a prostate test, a rectal test, a sinus test, a COVID-19 test, a respiratory tract test, a rapid viral test, a wound test. Oh, that's interesting. That's a new one. They have a rapid candida test. They have STI, a HSF, a HPV, a oral HPV. Anyway, they even have a dental test. So the one that you would do would be the urologic test service. Let me click on that. And how much is it right now? It is. So you pay for it, you usually pay for it in advance, although Medicare will pay for it. You can, if it's ordered by your doctor, you can call them and ask them about that. Reimbursement takes a little bit of time. Most of the companies don't like to do that because they don't get paid right away. Sometimes it's months before they get paid. So most companies in general prefer it when you pay up front. But if you have Medicare and your doctor's order it, Medicare will pay for it. Oh, isn't that interesting? $259. That's what it is. And I'll give you the link to it. Hi, Harriet. Nice to see you, honey. Thank you, Gay. Sandra says you have pain every day. Well, I again, out of an abundance of caution and seeking just basic data, having a next-gen test makes sense to me. The challenge, of course, is that getting your doctor some doctors don't like it because they don't know how to interpret it. So it puts them in an awkward spot because they get test results and they don't know how to interpret the test result. How are you doing, Harriet? Gay, mine is changing as I've gotten older. I actually had somebody the other day, they thought my hair was white. And they didn't see any red in it at all. And I'm like, what? How can can you say that? And then I turned around and showed them my back and went, oh, and they went, okay, you're a redhead. But it is getting very, I think that this is just the whole the whole cancer thing. It's definitely lighter up top these days. I've always said that I've wanted to have a long white ponytail, so I am okay with it getting lighter. It is weird. All right, guys. So I'm here as long as you have questions. We're getting very close to the end. We don't have as many people here as we did when we started. And so we've been going on now for about 2.5 hours. So if you have a question that you'd like to ask, let's do that. I'm going to do a last call for questions, last call for questions. Now I'm going to go film some videos. I'm going to go do some TikTok videos, I think, out on my deck. Last call for questions, last call for questions. Thank you for coming today, since it is a holiday. And Lisa, if you're still listening, honey, I'd really love to talk with you. I'd really like to help if I can. No charge. Absolutely. No, you guys, it's an 800 number. It's freaking free. It's okay. This is what we do. We are a patient education and support company. All right. Well, I think we're done. So I'm going to call it, and I'm going to go change my clothes and get myself outside in the sunshine. Sheena, you're very welcome. Gay, you're very welcome. Thank you, thank you, thank you. Wish you all the best. We'll see you next week. By the way, just to say, we are now having our fires. We're now starting back into fire season. So I watched the fire bombers fly over my house a couple days ago. And so please understand that fire season makes life very, very unpredictable. And there are periods of time where they shut down our power to prevent fires if we have a wind event. And so you are going to see me be much more vigilant about because all of our big fires happen on Sundays. I don't know why, but they do. So just be patient. If you don't see me, pay attention to the California fires because we all have to be on it because they're so dangerous. So, all right, guys, I will see you later. I'm going to say goodbye to YouTube first. Bye, guys.